Okay, while some people are still coming in, I would like to start the webinar. So thank you for joining us for another webinar of the WHO Technical Webinar Session series, sorry. The session today will be about quality criteria of Health National Adaptation Plans. You can see that for those who have already visited us, they know that we always hold the webinars twice a day to cover as many time zones as possible. And now we find ourselves in the afternoon session. We always have different country examples for the AM sessions and the PM sessions. So if you're interested, you're very welcome to watch our recording also of the AM session. My name is Yiqi Pan, and I'm a technical officer in the Climate Change and Health Unit at WHO. Just to give you some context where we stand, so today we're already here, so almost at the end of the technical webinar series for this year. And again, if you're interested in watching the recording, you can scan the QR code, or I'm sure my colleagues will also post the link in the chat later for your access. We have interpretation today. You can find interpretation if you go to your Zoom, and you can find the interpretation button. You can click on it and select the language that you're most comfortable with. For this session, we have interpretation in English, French, and Spanish. Yeah, this is the agenda for today's session. We're here, we're walking you through kind of the agenda. Then I'm going to hand over in a minute to Dr. Diarmid Campbell-Lendrum, who's the unit head of the Climate Change and Health Unit at WHO. And this will then be followed by a presentation by our colleague, Dr. Karen Polson, who is advisor in Climate Change and Health at WHO PAHO. And then we will have some country experiences, one from Mrs. Lauren Blanchard, who is from the Ministry of Health, Wellness, and Elderly Affairs, St. Lucia. And then from Dr. Edwin Edeh, who is a colleague from WHO Nigeria. This will then be followed by a group activity where we're going to talk about a little bit more in depth, kind of the content that was presented by Karen in smaller breakout rooms so we can also discuss and exchange ideas. Then we're going to come back for a quick group feedback session, also moderated by Karen, before we close. Just 2 notes on housekeeping. So we have set this up as a meeting. So you are able to unmute yourself or turn on your camera if you would like to speak. But if you're not speaking, we would kindly like you to ask to keep yourself muted just to ensure that the background noise is minimalized. Okay, so we're going to start with a quick Slido just to see kind of the temperature in the room, and also just how familiar everybody is with the HNAP process. You can go to slido.com and type in #WHOCCH, or you can scan the QR code with your phone, and then you will be able to see the Slido and participate in our first round of interaction. I can see some people have already joined. Thank you so much. So the question is, has your country already developed an HNAP? This is also just a temperature check because we always have a very diverse set of participants typically in the webinar. So we have several participants that saying, I don't know, and I'm not sure. And then few that said, yes, started. a good amount that have been involved in its development and implementation. That is wonderful. Always great to hear. Some are familiar with their content. Great. I think this is, I'll keep the Slido open for anyone who comes in later, maybe also to answer the questions. And with that, I'm going to stop sharing and hand over to Dr. Diarmid Campbell-Lendrum.
Thanks so much, Yiqi, and thanks to everybody who's joined this webinar. A big thanks as well to the team here, which has put together such a comprehensive and impressive set of webinars. As you've seen, this is one in a series which we think together give a really good amount of support and information to people in countries that are our main target audience in order to strengthen the public health response to climate change. I have to say it's also a really important series for us because we get to listen to the country experiences as well, and we get to hear what your challenges are and therefore what we should be doing to respond from the WHO side. And this webinar is a particularly important one. Obviously, this is an integrated series. They all support each other, but Health National Adaptation Plans are really at the core of what we think needs to be done in order to provide a properly comprehensive public health response to climate change. So you will either have attended or have seen that there was already an introductory webinar on HNAPs. And this webinar is more about ensuring that not only do countries have an HNAP, but they're of the highest possible quality. And when we talk about quality, we can talk about the different criteria, the different characteristics that make up a really good Health National Adaptation Plan. The first is that it really needs to be comprehensive. Obviously, climate change impacts on health in many diverse ways, and different stakeholder groups or specialists in different health outcomes will focus in on their issue, and that's perfectly appropriate. But we think that the overall National Adaptation Plan, the Health National Adaptation Plan, should take a comprehensive public health approach to ensure that populations are as well protected as possible in the round. The second headline criteria is the emphasis on the national within the HNAP. So we think it's really important that countries actually own and develop their own plans. There is a very big difference between a plan which has been developed fully by the national authorities, by the national government, and through working with stakeholders in country, that is very different and much better and more valid than a plan which is developed, drafted by a consultant, drafted in by an external agency. So we, as WHO and with our colleagues in PAHO, are very much in the business of working directly with national authorities, led by the Ministry of Health, to develop that comprehensive plan. And then the third headline I'd like to mention is that when we talk about quality criteria, that includes things like having the best quality evidence backing up the plan, but it also includes that it should have the maximum possible buy-in from the stakeholders who may be implicated in developing that plan. We would also hope that the plan will start to be prioritized and that it will actually have a clear view to a means of implementation, so that this isn't just a plan which sits on the shelf. And the final point I wanted to make is that although as WHO, we consider health to be the most important dimension of climate change, we recognize that climate change is a challenge that affects all of society and all of government. So we also think that it's really important that the health component of a national adaptation plan, or if it's a standalone HNAP, that it is fully aligned with and has the appropriate connections with the overall cross-governmental, cross-societal response to climate change. That gives it a much better chance of being supported and going forward. And it also recognizes the connections and opportunities that there are to support health through action, not just within the formal health sector, but through connections with other health determining sectors, such as energy, such as agriculture, such as water and sanitation and so on. So that's why we wanted to have this second webinar in the series, which really focuses in on the quality of HNAPs and basically how to get a good one. With that, I'll just say once again, thanks for the opportunity to speak to you and hand back to Yiqi for the rest of the webinar.
Thanks, Diarmid. Thank you for giving us the opportunity to have you and to come in and provide those remarks and set the context for the session today. Yeah, without further ado, I would like to hand over to my colleague, Dr. Karen Polson from PAHO. Karen.
Thank you, Yiqi. Good morning, good afternoon to everyone, wherever you're joining from. It's good to be able to meet with you all and to share this presentation on looking at quality criteria for HNAP. As Diarmid indicated, the HNAP is a very, very important document. So I'm going to share my screen in a bit, and permit me to also turn off my video while I'm presenting, because the weather here in DC is not very good this morning, and I don't want to lose you. Okay. So just give me a sec. Put in presentation mode. Okay, let me know if you're seeing okay, please.
Yes.
Okay, thank you very much. Okay, so we're looking this morning or this afternoon at quality criteria for the Health National Adaptation Plans, or HNAPs as we call them. Now, this webinar covers material from a broader training package on building climate resilient and low carbon health systems. So as Diarmid mentioned, this is part of a package, a series, and this webinar in June, we looked at HNAPs, explained the process of developing HNAPs, and then today we're going to look at the quality criteria for HNAPs, and in future webinars, you look at using the WHO framework and applying the knowledge to the broad context of health systems. So HNAPs, as was mentioned, are a critical component of climate change and health planning and are complementary to the nationally determined contributions and so on, which are covered in other modules. So when we look at building climate resilient and sustainable health systems, there are some questions that we can ask ourselves. What are the impacts of climate change on health and the opportunities for the health sector to decarbonize, and the potential health co-benefits of climate change mitigation? And as we ask the questions, there are areas where WHO can and does provide support to countries. So in this particular one, we can provide support in terms of conducting the vulnerability and adaptation assessments, co-benefits assessments, assessments of greenhouse gas emissions at systems and healthcare facilities levels. We can also ask, sorry, let me back up a bit. We can also ask about the plans and strategies needed to build climate resilient and low carbon health systems, how to finance these actions, which is very important, and what interventions we can implement to address climate sensitive health risks and strengthen the resilience and low carbon sustainability of health systems. And then, of course, whatever we do, we have to look at monitoring the progress, not only globally, but also at the national level, which is very important. And we do this through several means, including surveys. So just to put in context then, Diarmid did mention some of this in terms of the alignment with the HNAP and the National Adaptation Plans. Now, just to give a bit of explanation, I know you may have gone through for those of you who participated in earlier webinars, but just as a reminder for all of us here, that the National Adaptation Plan is a process established as part of the United Nations Framework Convention for Climate Change, or the Paris Agreement Agenda, and it's intended to provide support for medium and long-term adaptation planning needs in developing countries to build resilience to climate change across all relevant sectors. and it builds on the National Adaptation Programs of Action. So there are a lot of acronyms, as you know, we're talking about. So, NAPA it's called. And that process is designed or was designed to support the least developed countries to identify priority actions to respond to urgent and immediate adaptation needs. So that's the NAP and the process of the NAP. The HNAP then is the health component of the NAP and is led by the Ministry of Health as part of the National Adaptation Planning process. So it really is also an evidence-based tool to guide health systems adaptation. So now we're going to then look at the quality criteria for the HNAPs, and there is guidance provided by WHO. That's a snapshot of the cover of the document, and this was published in 2021, and the QR code is there so you can easily access. And this was developed based on years of experience by WHO in supporting countries to develop their HNAPs. So there are 6 areas of quality criteria. Now, please note that the criteria are proposed, they're not prescriptive, and so they need to be adapted to the context of the country, because the context, as we know, of countries is always changing, it's dynamic, it's uncertain. Also, the climatic conditions are changing and there's new knowledge and technologies, but they provide, these criteria provide us with some key points to consider when developing their HNAP. So there's leadership and enabling environment, cross-sectoral coordination and policy coherence, comprehensive coverage of climate-sensitive health risks, comprehensive coverage of adaptation options and actions, resourcing, monitoring, and evaluation and reporting. So those are the 6 components that we will go through in this session. In terms of looking at the components, then we also have to consider the components in relation to each step of the developing of the NAP or the HNAP. So there are 4 steps, as you would have gone through in the earlier webinar session. So we're looking at the quality criteria in relation to each of these steps. So that's how we will present it. So when we look at laying the groundwork and addressing the gaps, which is the first step of developing the HNAP, then there are 3 components here. We have to ensure that first of all, that the HNAP is aligned with the NAP process. So every country will have to define its own process, but it is important that to ensure that the health sector is engaged in the national climate change agenda and that there are the coordination mechanisms in place to facilitate this. It is also important and necessary that health workforce is sensitized to mainstream climate change in the health sector strategies, plans, and programs. And the second consideration also has to do with taking stock of available information, looking at what's available in terms of research on health risks of climate variability and change, what knowledge exists in terms of the factors or increasing or decreasing vulnerability, the policies, and so on. And then conducting a vulnerability and adaptation assessment is recommended if it is not yet done. That's one of the things that needs to be done as part of laying the groundwork of the HNAP. And of course, the third component in laying the groundwork has to do with addressing the capacity gaps in understanding the HNAPs. So any adaptation plan should look to aim to strengthen the development and availability of evidence, build the data, reduce knowledge gaps, and inform relevant policies. So let's look at a case study from Nepal using the quality criteria of leadership and enabling environment. So in developing its HNAP, what Nepal did was to first of all recognize the importance of developing the health component of the NAP. That was the first part, and then they had consultations. A dedicated unit was created within the Ministry of Health for coordination, and of course, there's strong leadership by the Ministry of Health, and this we cannot overemphasize. So what we're saying is that the Ministry of Health, and you'll hear us saying that over and over with the development of the HNAPs, the Ministry of Health should lead the HNAP development and integrate into the NAP process to ensure that the health priorities and the technical expertise are central to the national planning. So even when the document is written in consultancy, as Diarmid mentioned, sometimes consultants may be brought in to help with the process. The government needs to participate and endorse it. And also it's important to ensure that the document is not just a formality within the HNAP, but it is an ongoing active process within the health sector, ensuring also that it filters down to the operational levels so health programs become climate informed. So that's how Nepal started in terms of ensuring the leadership and enabling environment as they were developing their HNAP. When we look at the criteria now related to cross-sectoral coordination, policy coherence, what they did, they had the active consultation with Ministry of Education, Ministry of Environment and other stakeholders, a dedicated unit within the Ministry of Health to manage the overall process of coordinating the HNAP, the implementation and its integration into the NAP, and also prioritization of climate change and health at the national level. So the cross-sectoral NAP coordination mechanism within with health determining sectors is very important, and it is recommended the ongoing involvement and commitment of the Ministry of Health to ensure the continued prioritization of the health sector in the national climate change agenda and for the effective implementation of the HNAP. So some of the things we need to consider at this stage then is, in developing the HNAP and bearing in mind the quality criteria, is there a strong and collaborative connection in your country? And potential impacts of the plans and adaptation measures of other sectors on health. So those are some things that are important to consider as we're looking at the synergies and the coordination with health determining sectors. Now, in step B, in preparing the HNAP, so we did step A, laying the groundwork, step B, the preparatory elements, and you'd have gone through this before. So that includes conducting a health vulnerability and adaptation assessment, reviewing implications of climate change on health-related development goals, and development of a national health adaptation strategy that identifies priority adaptation options. So once the broad health strategic goals are defined within the national strategy, then a Health National Adaptation Plan needs to be developed that specifies how to achieve those goals over a specified period of time. So let us look at another country example. Let us look at Ethiopia. So Ethiopia, in developing their HNAP, the preparatory element stage, looking at the comprehensive coverage of climate-sensitive health risks. So first, they conducted their VNA in 2015. That was their first VNA that they conducted. And then from that, they found climate-related extreme weather events like droughts and floods, that those were a continued threat for them. So that they found out from conducting their VNA. And then they looked at what were some of the key climate-sensitive health outcomes and risks. And for them, that included diarrhea, malaria, yellow fever, and dengue. And then the VNA informed the HNAP development. So they had the evidence there. So the VNA was used to ensure that the HNAP was based on best available evidence specific to their setting in Ethiopia. And where possible, it is recommended then that the VNA is comprehensive and that countries are ambitious in covering the climate-sensitive health risks in the assessment, so including as many as you see within your context. And so we see what Ethiopia found, that climate change affects populations in situations of vulnerability disproportionately due to a lack of adaptive capacity and appropriate coping mechanisms. And so it is important for us to consider specific populations, especially those in situations of vulnerability, for the range of climate-sensitive health risks. So even if all health risks are considered, it is necessary to prioritize the health risks for the HNAP. Continuing with Ethiopia. So as I said, the VNA informed the HNAP development, and that contributed to the creation of multi-sectoral and multidisciplinary expertise. So they had these groups, and that included knowledge transfer to universities. So it was a real comprehensive a group that included persons from different disciplines. And so the evidence generated from the VNA was used to establish an early warning and surveillance system for climate-sensitive diseases. And that system has been piloted in 11 health facilities in Ethiopia. So as the HNAP is part of a long-term process of adaptation planning, a comprehensive range of adaptation options for medium, long-term timeframes is recommended. And then prioritize the actions for inclusion in the HNAP based on a range of factors, based on, for example, priority adaptation actions, based on the actual criteria used to set the priorities. That will depend on the goals of the VNA conduct, the priorities of the Ministry of Health, the specific climate-sensitive health risks and resources. And we also have to look at the fact that the adaptation options that are not, take note of the fact that the adaptation options that are not initially prioritized may be included in future iterations of the HNAP. So again, the HNAP is a living document, as we'd like to say. But if you do not specifically address the climate-sensitive health risks in your initial work, it may still be captured in actions that aim to build the resilience of the health systems. And for each adaptation option, there are many possible constraints or barriers to implementation. There's the financial constraints, human constraints, technological, and the expected time frame for implementation might also be a barrier. And there may be other requirements that are necessary to consider for implementation of the HNAPs. There are several methods that can be used to prioritize these aspects of the HNAP, but that we'll cover in a little bit later. So still on step B, which is the preparatory elements. So as I mentioned earlier, it's important and it's recommended that countries are ambitious in coverage of the climate-sensitive health risks and are able to identify medium, long-term priorities and adaptation actions to address these. So it can still be prioritized if you have not covered it in your initial thing, but if it is not included, then there's no record of it. And so it is important that these are considered. We may not be able to specifically address them within the HNAP, but at least to have actions that aim to address them in line with building health systems resilience. So for each climate-sensitive health risk, it is crucial to incorporate information related to the populations in situations of vulnerability as determined by the biological, geographical, social, and other factors. So that these risks are continually considered in periodic vulnerability and adaptation assessments to monitor any changes. So both the HNAPs and the VNAs is not something that's done and that's it. It's something that has to be continuously done and of course monitored at each phase. So this, for example, gives a list of some of the potential the health impacts of extreme events, for example, the climate sensitive health risk, and giving examples which then can be included. So in 2020, actually, WHO did a review of national adaptation plans. And then what was found that in the national adaptation plans, there were a range of climate sensitive health risks which were covered. And you can see how they're grouped, mainly vector-borne and waterborne. Those are the most common ones that were included in NAPs. And for vector-borne, of course, malaria, dengue were tops, and for waterborne, diarrhea and diseases and cholera. But even in doing this review, what was noted that there was a clear gap in the NAPs between the number of climate-sensitive health risks and the number of NAPs, which included specific adaptation actions to address them. So the top bars, the dark green ones, are the number of NAPs that mention the particular climate-sensitive health risks, and the lighter green are the ones that have included at least one action that specifically targets that risk. So for example, while all the NAPs mention waterborne or water-related health impacts, just over half included at least one adaptation action. 16 of the 19 NAPs mention malnutrition and foodborne diseases as key climate-sensitive health risks, but only 6 specify related adaptation actions in the health chapter of their National Adaptation Plan. On the other hand, many health actions were targeted at systems strengthening, and those can also be applied to a wide range of climate-sensitive health risks. So there are actions that can address these risks to some extent, which could be included in other chapters or other sector national adaptation plans, such as water resources and agriculture. But we need to ensure that as we're developing our HNAPs, that we include and think of the climate-sensitive health risk and suggest some actions that could be taken to address these. So on to step C. So we did A and B, and now C is the implementation strategies. So again, if you think we're building the HNAPs, and in line with each of the steps, we're looking at the criteria. So just as a quick revision, step C is the implementation strategies, and it is about ensuring that the plan is able to move to the implementation stage. So it's not just developing a plan, but having an implementation strategy, which include components such as how we operationalize this HNAP and promoting coordination and synergy with the NAP process. Important to remember is that the HNAP offers the opportunity to ensure that health risks of climate change are considered in health planning from a national to a local scale. So it's working across all scales. And a key component of the implementation phase is to ensure that the health sector is connected with the overall NAP process through proper representation and engagement in the process, and by periodic communications of progress made in health adaptation implementation. Strengthen the capacity of development and health planners is required to ensure an enabling environment exists for the implementation of the health component of the NAP. And the HNAP is envisaged as a process embedded within the national health process and existing programs rather than an independent process. So it really has to be an integrated process. So it is the plan for climate and health resource mobilization. And this is an area in which WHO supports countries to develop single or multi-country project proposals to access climate financing for health. So the HNAP is really, really important, an important tool for us in health, especially for prioritizing actions, yes, having the implementation strategies, but also in trying to ensure that we can use the information and the evidence from the HNAPs to help to mobilize resources. So let's look at a case study from Republic of Montenegro in relation to step C and the quality criteria of resourcing. So they had a national working group with representatives from different key health institutions, and there was a strong emphasis on the adequate allocation of human and financial resources. When we think of it in our countries, we recognize that if we don't have that allocation, then it's difficult to have any implementation taking place. And then they developed a resource mobilization plan, which was key element for implementation. So to ensure adequate human and financial resources, the country team nominated a national working group with representatives from various health institutions, and they identified appropriate modifications through an enhanced understanding of what works and why, determining where improvements are needed, and identifying the issues that should be addressed for the effective implementation of policies and programs. And there was also a strong emphasis, as I mentioned, on the adequate allocation of resources. And then the resource mobilization plan was developed as a key element of the action plan for implementation of the program. And the final step in the HNAP development has to do with reporting, monitoring, and reviewing. So it is important that we monitor and review and update the HNAP regularly and report on the progress. So in terms of looking at these final steps, it includes initiating or strengthening monitoring systems for the health, vulnerability, or resilience supports for future progress on the HNAP goals, and iteratively updating the health component of the National Adaptation Plan. That can also be done as the NAP itself is being revised to ensure that the burden is reduced, especially from the beginning, and to also ensure the alignment and making sure that all the reporting processes are aligned as best as possible to increase the engagement for persons engaged in the process. And so the final case study we're looking at here is with from Tanzania. So they developed their HNAP in 2018 and included a comprehensive monitoring and evaluation framework. So here the quality criteria we're looking at is monitoring, evaluation, and reporting. So this is a diagram of the M&E logical framework included in the HNAP. And this guided the development of indicators at each level, such as those that measure and monitor progress, so the process or input and output indicators, and the outcome indicators, which measure and evaluate the effectiveness of the HNAP. And it was used to describe the indicators, means of verification, frequency of reporting, and responsible institution for each objective and action within the implementation plan. And the plan also prepares for regular evaluation of the HNAP itself, considering its relevance, effectiveness, and efficiency. So this is an applicable framework for many settings, starting from the ground up. So starting from the ground up, some of the questions we can ask, are the actions being implemented? So this is after developing the HNAP and having an implementation plan, looking at the reporting, monitoring, and reviewing. Are the actions that are included in the HNAP being implemented? If they are they contributing to the strategic objectives? And are we meeting our wider HNAP objectives? That is, are we increasing the resilience of the health system to climate change? Or are we reducing the health effects, health risks on the populations? And so this just shows a bit more in terms of what I just explained with respect to the questions and so on. So the monitoring looks at the adaptation actions, monitoring and evaluation looks at the strategic objectives, and the evaluation looks at the overall HNAP objectives. So just as a reminder, as we're closing off this presentation, is that in the process of developing the HNAPs, there are 6 quality criteria that can be considered at each stage, at each of the 4 stages of developing, from the laying the groundwork through to monitoring and evaluation. Again, just to note that the criteria are not prescriptive. So depending on your country situation, you can adapt accordingly. But they provide, the key criteria provide some key points to consider when developing your national adaptation plans, Health National Adaptation Plans. And with that, I stop here and hand back to Yiqi. Thank you.
Thank you, Karen. Thank you. You're such a great presenter, and I'm sure the participants also really enjoyed your very clear and concise presentation. Yeah, and I hope that gives you a good introduction of the HNAP quality criteria that we will look into in more depth in the group work. So yeah, now I would like to hand over to our first country speaker, who is Mrs. Lauren Blanchard. She is the health planner at the Ministry of Health, Wellness, and Elderly Affairs in St. Lucia. And Mrs. Blanchard, you can feel free to share your screen if you're ready.
So good morning, everyone. I will, like Dr. Polson, I will turn off my video because we're having some issues with the internet sometimes. So I'll turn off the video to ensure that we have a good connection. So thank you. Okay, thank you, everyone. Good morning, good afternoon, good evening, colleagues. I know we are all in different parts of the world. It's a morning here in St. Lucia. I just wanted to grace you all with a little photo about our iconic PAHOs. So let me take this opportunity to thank WHO and PAHO for providing this platform for St. Lucia to share our experience in the HNAP development. It is my hope that we can provide some useful nuggets of information which can help better the process for other countries who are thinking of or who are about to undertake the development of their Health National Adaptation Plans. So in the presentation, I will just provide a brief background on our HNAP. We will then take a look at the key priorities of the St. Lucia HNAP so that persons can get an appreciation of the key priorities and would be able to contextualize some of the points which will be made later in the presentation. And in the interest of time, I will zero in on the first quality criterion, leadership and enabling environment, and demonstrate how St. Lucia HNAP development really fulfills this criteria. And I will then look at some potential areas for improvement and then make some recommendations. So for St. Lucia, our National Adaptation Plan, it preceded our HNAP. And our National Adaptation Plan is for the year 2018-2028. The NAP was led by the Department of Sustainable Development, and it covers a range of sectors of which health is included. Each sector was required to further develop what they call the SASAP, which is the Sectoral Adaptation Strategies and Action Plans, which is essentially the HNAP. Under the NAP, there were 3 outcomes for health, which was enhanced enabling environment for health-related climate adaptation action, improve public health under changing climate, and strengthen preparedness to climate variability and extremes. And there were 7 strategic objectives under those 3 outcomes. So our NAP covers the period for 2023 to 2033, and the strategic objectives and action items are aligned to our umbrella NAP. The ministry's efforts for the development of the HNAP dates back as far as 2019, when we submitted a proposal for its development under the GCF Readiness Project. This took some time. We did not get it in time. So we actually got the funding under the EU CARIFORUM project, which was led by PAHO. And we quickly took up the opportunity to develop our HNAP. So it was completed last year in 2023. So our health strategic priorities, we have 4, which is listed above: to build the capacity of the MOH in terms of governance, looking at an enabling environment for the health sector to respond and adapt to impacts of climate variability on public health, to reduce the vulnerability of the health sector to negative impacts of climate variability, extreme weather events, and health shocks, and to continually improve the health sector's resilience to thrive under climate variability and extreme weather events. So I just gave a little snapshot of what we had under our first strategic priority. We had 4 our first priority, we had 4 strategic objectives with different action items. We had to improve the institutional capacity to govern, looking at the national and legal regulatory framework to facilitate health planning and climate change adaptation, to improve the capacity of the MOH to make evidence-based decisions, and to strengthen the national health information and health surveillance system, which would lead to better planning. For the health strategic priority, we had 8 strategic objectives, to strengthen. I will not go through them, but we could just, when the PowerPoint is shared, you will have an opportunity to look at them in detail. For the health strategic priority 3, there were 8 as well. Ready to look at looking at our different health system, our hospitals, our primary care, to ensure that they are able to address some of the conditions related to the climate related diseases. And then the last strategic priority there were five objectives, which look at the M&E, looking at the systems approach to healthcare management, improving the quality of national health information system, the capacity of to conduct health-sensitive climate change research, and to improve healthcare stakeholder engagement. So we look at, like I said, we would look at the leadership and the enabling environment. That's one of the criteria that our HNAP development demonstrates very well. The ministry's leadership in addressing climate adaptation in health predates even both the NAP and the HNAP. From as early as 2015, the ministry, with the assistance of PAHO through DFID, we secured funding for the the Smart Hospital Initiative, which supported 16 health facilities to make 14 health facilities and 2 non-health facilities in making the facilities safe and green. After this initiative, the ministry also made efforts to secure more funding under a World Bank IDA arrangement for expanding the Smart Hospital Initiative to 12 more health facilities, and this project is ongoing. The ministry also has a draft concept note being supported by the 5 Cs for the Smart Hospital Initiative to support the other primary healthcare facilities, as well as the hospitals and the private sector. So this goes to show you that even before the NAP and the HNAP, the ministry was already thinking about climate change and helping to strengthening our primary healthcare facilities to deal with the climate change, the changing weather patterns, to ensure that they were safe, that they were green, to reduce our carbon footprint. So also the ministry ensured that health was adequately represented in the NAP. So we did get our representation in the NAP. We had a focal point, which was liaising with the Department of Sustainable Development to ensure that health was adequately represented in the NAP. So currently, the ministry has 2 focal points for climate change and health, and this was crucial for the development of the HNAP and essential for driving the process of integrating climate change in health programs, especially for countries like ours, which are resource constrained and are not able to assign a whole unit to address this initiative. Over the years, the ministry has actively sought out opportunities for funding for the development of our NAP, like I said before, the GCF Readiness Project, and then successfully through the EU CARIFORUM project through PAHO. So this goes to show you that there was the leadership, the willpower by the ministry to get our NAP prepared, because the NAP did not flesh out our response as it should. Each sector was supposed to flesh out their own adaptation plan. So although there was a consulting team who prepared our HNAP, Ministry of Health was very actively involved in the development through our 2 focal points who worked with the consulting team, and who also brought our stakeholders at Health together to ensure that they were actively involved in the development. In terms of the government endorsement and approval, one of the hallmark achievements of the HNAP development is that there was buy-in from the highest decision-making authority in the country, the Cabinet of Ministers. A team from Health, including the Permanent Secretary, the Chief Medical Officer, the 2 focal points for climate change and health, along with the consultant, presented to the Cabinet of Ministers, after which a Cabinet memorandum was submitted. And by Cabinet conclusion, the Cabinet of Ministers endorsed the HNAP strategic priorities. Also, the consultant ensured that the Ministry of Finance confirming that our HNAP was in alignment with the St. Lucia's overall national development goals. There was active engagement of the health sector in the process to formulate the NAP. So like I said, the health sector was adequately represented in the NAP, along with water. There was disaster preparedness and all other sectors, they were represented in the NAP. In terms of climate-informed health planning and programming, there was active consultation with program heads at the Ministry of Health, during the formulation of the HNAP, because at Ministry of Health, we have different departments. We have the nutrition department, we have dental, there's community nursing. So there was a concerted effort to ensure that there was consultation with all program heads so that they were aware and that they gave their input in the development of the HNAP. The different program heads were also pulled into separate consultations to provide time frames for the implementation of activities relating to their programs. This informed the implementation strategy that is outlined in the HNAP. Sorry. In terms of climate-informed health planning and programming, so looking at areas for improvement in our own development process, there should be in terms of climate-informed health planning and programming, there should be a concerted effort to embed climate change within our current national health planning. Although we did involve the different heads in the process of the HNAP development, I still believe that there's this idea that climate change and health still resides with the focal points. By embedding in our national health planning, this will ensure that there's sustainability, and it should not be an independent process. So like I said, some program heads still look at climate change and health as a responsibility of the two focal points in health. Also, there should be cross-sectoral coordination and policy. Climate change impacts health through multiple pathways that cut across different sectors. We have water, we have agriculture, we have disaster preparedness. And effective adaptation requires integrating health strategies with actions in areas like water, agriculture, environment, disaster management, and urban planning. Our HNAP could be strengthened through this cross-sectoral coordination, as these sectors may have their own priorities, which may not always align to health. So we have to ensure that that is a possible weakness within our HNAP, that there could have been a more, although we did consult them, but it is not really reflected in our HNAP. So what are the recommendations that I have in terms of our HNAP development? I can't emphasize enough to ensure that HNAP development takes on a multi-sectoral approach. And this will ensure that the adaptation efforts will be addressed in a more holistic manner and not piecemeal, because like I said, health is impacted by many sectors, and we need to ensure that health is addressed in a more holistic manner with regards to adaptation to climate change. Recently in Washington, I had the two focal points attended. We have a joint learning network collaboration with the World Bank, a 2-year collaboration on climate change and health. And one thing which stood out for me during that engagement was the need to engage our communities in planning. So when we include the public in consultations, we are not just checking a box. We're really gathering valuable insights from the people who experience the challenge firsthand. And we really cannot plan around the people that we are planning for. We should include them. By listening to community members, healthcare workers, and at-risk groups, we can design an app that addresses the actual health challenges people face due to climate change. And this really ensures that the planning is realistic, relevant to the people, and beneficial to them. And when people are included in the development of the HNAP, they are more likely to feel a sense of ownership and responsibility for their own health, and they become part of the solution. And this really encourages buy-in from the public when we include them in the planning for HNAP. And it's not a superficial out of the air thing for them, that they actually own it. There's also a need to ensure policy coherence and alignment. National policies such as climate change adaptation strategies and development frameworks like the SDGs already address critical national priorities. And by integrating our HNAP into those existing policies, we're already building on the work that exist, and we are not creating a separate and standalone plan. And this integration leads to a more coordinated response to climate-related health risks, with every sector contributing to a common goal. And another thing, Dr. Polson spoke about capacity build in terms of the Ministry of Health owning the HNAP development. And one thing I should stress on is capacity building for the Ministry of Health, because sometimes the Ministry of Health is not too knowledgeable about climate change and health. There's a need for us, and if countries are to own the HNAP development process, there is a need to build a capacity of the ministry in climate change and health and HNAP development. Thank you.
Thank you, Mrs. Blanchard. I think it's always great to hear the theoretical presentation and to kind of have an idea right on the theoretical quality criteria, and then to see really how countries are implementing it on the ground. So thank you so much for that. Yeah, with that, we're gonna move to our second country example. And it's my pleasure to hand over to Dr. Edwin Edeh, who's our colleague from WHO Nigeria. Great to see you. So I'm gonna project the slide. So I hope this is visible.
Yeah, thank you, Pan. Thank you, Pan, for the incredible privilege of having me on this very important program. And I want to say big thanks to the whole colleagues and the HQ and the attached team for this important program. So I'll be speaking on the quality criteria we've used for the ongoing HNAP in Nigeria. My name is Dr. Edwin Edeh. I oversee climate, health, and environmental work in WHO Country Office, Nigeria. Thank you. Okay, so Nigeria is already having its fair share of the impact of climate change. We are people of about over 210 million population, occupying massive land areas of about 923 1,000 kilometers of land. We've used our forest cover has been used by about only 9.9% of our forest of our land mass is forested, which is far below FAO recommendations. So we are seeing spikes of the impact of climate change, from flood to drought. We've seen over 22,000 persons were affected by the flood incidents that happened in 2022. And we're also seeing spikes in outbreaks of diseases like cholera, resulting from water contamination and so many other things. So climate change is one of the top environmental health issues we are having in Nigeria, in addition to open defecation, chemical issues, which are also very paramount in most, or very common in most developing countries. Okay, so currently in Nigeria, 29% of the national burden of diseases is attributable to risk factors from the environment. So here we are looking at the combination of water, sanitation, hygiene, climate-related risks. And Nigeria has already signed the Paris Agreement of 2015 on climate change, and it is part of the climate negotiation of the UNFCCC. And we have already, if you look at the greenhouse gas emission in Nigeria, is about 3.37 ton of CO2 equivalent per capita. And in our NDC, which was updated last year, we have set a target to reduce our gas emission to 442.5 metric ton of CO2 equivalent. So these are real evidences, and there are a lot of predictions that some of the coastal communities are going to have a lot of displacement affected by flood levels. So indeed, Nigeria is having its own fair share of the reality of climate change. So given that context, we have quite we have been committed to several policies and global systems, documentation and agreements, to ensure that the health sector in Nigeria is well positioned to provide the needed action for addressing climate change. And one of those is the COP26 climate health commitment, which was made in the year 2022, which Nigeria was one of the countries that has committed. And we have also one of the states that have committed regionally to the Library Declaration, which was made of all the ministers of environment in Africa, health and environment. And of course, we are also a key champion in promoting the global strategy for health, environment, and climate change by WHO, and as well as the SDGs. And I'm super happy that I'm facilitating this program right from the city of Dakar in Senegal, where I'm joining the Climate Health Africa program going on with also teams of other colleagues from other sectors coming to support this important issue of climate change. So when we look at the, we have conducted the VA, and it's quite an extensive, rigorous process that involves a wide range of consultation, data collection, monitoring, and come up with recommendations that have informed our development of the Health National Adaptation Plan, the HNAP. The HNAP, which we have developed the framework, we are fine-tuning to all the various information in it and ready to finalization before the next COP. But there are some key things that we have learned through the process, and one of the key areas which we have selected as our important criteria is on leadership and enabling environment in Nigeria. So under leadership and enabling environment, we have prioritized, we understand the rationale why the health sector need to sit on the front table, and that is the Ministry of Health, which is leading. Under the Department of Public Health, Climate Change and Environmental Health Division. So all other issues that concerns the different other sectors that relates to health is being housed under this ministry, and they're the one that lead the process. Okay, but in addition to that, we have also ensured that we have massive consultations and engagement with different health sector players, including the private sector, and we have 36 states plus the FCT, the Federal Capital Territory in Nigeria, and we have set up desk officers across all of these 36 states before even we have signed the COP26 commitment. So we make sure that all of these stakeholders are properly engaged, and across the 3 levels of care, talking about primary, secondary, and tertiary care players are all be part of the discussion, in addition to other MDAs, ministry agencies, and parastatals who are within Nigeria. We have also taken critical steps to see that there are reforms and transformation going on in the Nigerian government. Under the ministry, we have what we call the SWAP, the sector-wide approach, which come up with a blueprint by the new minister to reform the health sector along strategic areas. And one of those key areas we have under health emergency, we are properly situated climate change as one of these key areas, so that it aligns with the vision of the health sector moving from now to the next 3 to 5 years to come. Okay, and that's clearly also aligned with the WHO 4th generation of country cooperation strategy, what we call the CCS, which is WHO documentation that shows how it's going to operate in each of the country. And part of the CCS for Nigeria, climate change is a very important issue. So we are already integrating that even into so many disease programs, mental health, malaria, and so many other areas. But one other thing that have also given us one other area of progress is we already have a One Health multi-sectoral plan, which we have also plugged in all of this into. And very importantly, we have also secured government endorsement and approval of all of these processes for driving climate health with strong commitments, which is backed also not just by the Ministry of Health, but by also the NCCC, the National Council on Climate Change in Nigeria. And one of the members of one of the team who is working on the NDC is here with us in Dakar for the Climate Health Africa meeting. The goal is to make sure that by the time our HNAP is out, the next review of the NDC for Nigeria, which is the National Determining Contribution, there are health recommendations that is part of that document. So the second area which we have, so if you look at this, are really pictorial evidence. On the right, you see Dr. Kelias and Siabosa during the signing of the COP26 commitment. On the left, you see the WHO of Nigeria having a meeting with Lagos State government and handing over the CCS document to him and making some advocacy for promoting climate change and integrating into health emergency in the country. In the middle is the validation of the VHA report, which is being led by the Ministry of Health, supported by WHO, UNICEF, and other partners, the FCDO, which have come very strongly to support all of this initiative and to make sure that all stakeholders are carried along. And we're also trying to do some, based on those recommendations, some pilot initiative and projects are springing up and align with community participation. So the second criteria which we've taken strongly is around comprehensive coverage of climate-sensitive health risks in Nigeria. So doing this, VA, comprehensive VA was properly conducted and is very comprehensive, taking and also make sure that it is conducted and validated and also finalized. But in addition to that, we make sure that during the VA, we have looked at secondary data from different sources, data from climate. We have what we call the NCP, the Nigerian Climate Report, which is being led by the NIMET and other meteorological agencies, including what we call the WashNorm report, which is a sector-wide report that reports the wash situation. So we triangulate all of this data and we use this data to look at what is going to be the future of climate and its impact on health in Nigeria. So all this we are taking into consideration. But most importantly, we have ensured that we prioritize priority health risks in the country, giving all of the challenges, what is important, what needs to be followed first, and what are the key areas we need to follow. Also looking at what area do we need to put money in the nearest years to come. So this is just a pictorial evidence of the data modeling that has been done based on the forecast and prioritization. You can see from there, based on that deterministic, probabilistic modeling that has done, it is anticipated that 21% of the burden of diseases in Nigeria is due to climate change, and this has been supported by FCDO and also other organizations who have come in. You can also see the list of some of the reported health cases in Nigeria and how we begin to prioritize them and look at where do we need to put money first. And one of the key areas which I want to highlight is around the area of the capacity gap. The previous speaker talks about some members of the government who don't understand the issue of climate change. Yeah, there's a big gap, okay, in the understanding of climate change within the health sector. And that is why we are prioritized to see how we can develop a climate smart health workforce in Nigeria, in addition to other investments in health infrastructure. Okay, so looking at the data from the VA and the ongoing work on the HNAP, we have seen that there are some certain essential climate health services which we have prioritized at the country office, and this include climate health infrastructure. UNICEF is coming in to do what they call the Project CRIP. We have also seen there's a need for us to integrate telehealth services into climate health emergencies for flood, and we're already engaging with NEMA to provide some of these services. There's also need for us to look at climate knowledge programming and facilitate some level of emergency plan at the level of the health facilities, in addition to building a climate smart workforce for Nigeria and within the continent. And this cut across coordination, evidence-based capacity and modeling, and providing some pilot models of project, as well as providing technical guidance to the government across these areas of work. Okay, so this is some of the key progresses we have recorded over time. I recall that in 2015, WHO helped all the countries to develop the climate profile, and Nigeria is one of the countries that were part of that. And building on the profile, we have committed a competencies commitment. In addition, we have trained several climate debt officers across the 6 geopolitical zones in 36 states. We have validated our VA. We are in the process of finalizing our HNAP. We have also supporting emergency health intelligence, giving the insight from climate change to different agencies, as well as finalize our roadmap for a sustainable healthcare waste management. We are launching very soon what we call the Project CREST, which is around climate resilient environmental sustainable transformation within the health sector, which is to promote green and safe health facilities across the country with few pilots. Right, so these are some of the key next steps. Is to want to launch the VA report, want to finalize the HNAP and accelerate some of the climate health initiative, as well as launch our flagship initiative at the country office, working with the government, and as well as push towards the NDC update in Nigeria. Okay, these are some of the areas where we are also looking for some funding that are very, very strategic for Nigeria. Is around the building of the health climate workforce. We thank colleagues from Afro were able to secure some little funding, which want to pilot even in one state to do some energy efficiency, renewable energy efficiency work in some health facilities, build some of the climate build capacities of the health officers on the energy transition, as well as greenery, as well as also greenhouse gas emission calculation within the health facilities. So we have these three initiatives, but some of the funds we are looking for is not just for the intensive work, but actually catalytic to do show examples and allow other partners to come in and try the process. So in the country office, of course, CHE is a very broad, wide area with so many issues emerging, but we have prioritized 4 important things, which is water, sanitation, hygiene, climate change, chemical safety, as well as health and health policies, which are very key. And we're not just doing this in one cluster, we're mainstreaming it into so many more cluster programs and across these programs in the country. And what we do across from advocacy to prioritization, priority project and intervention, as well as evidence generation and coordination. Thank you so much for the incredible privilege of having me. I want to thank the attached team and the Afro CHE team and entire colleagues, and thank you all of you for listening. God bless you, really good.
Thank you, Edwin. Thank you for joining. Like you're being at a different meeting right now, so we really appreciate it. And thanks for the clear and engaging presentation. Since we're a little bit short on time, I would move right to the next point on the agenda. So we have a small group work prepared where we would like to go a little bit more in depth into the quality criteria. So let me just quickly share my screen. Okay, so we will have 3 breakout rooms. One is the main room, so you can remain in the main room to talk about these 2 quality criteria: leadership in an enabling environment and cross-sectoral coordination and policy coherence. You can stay in the main room, especially if you require interpretation, because we will only have interpretation in the main room. Then we will have another breakout room where we cover these 2 quality criteria of comprehensive coverage of climate-sensitive health risks and of adaptation options and actions. And then the 3rd breakout room is resourcing, monitoring, evaluation, and reporting. And feel free to join the breakout room that you think is most relevant to your work or that is the most interesting to you. I will see you on the other side. Let me open the rooms.
Thank you very much. And I will wait to see when they are rejoin. Oh, Yiqi, you're back. Sorry.
Yeah, you're back. Surprise. No, thank you so much, Karen. And thank you for everyone who have joined the discussion. We are at we're on point, we're a little bit beyond. So I'm just gonna very, very quickly point to our next webinar, who's gonna be the last webinar in this year, which is gonna be on gender, climate change, and health. It's taking place on the 16th of October. And we have also opened another Slido. You can join again under the same link that we posted before, and then I'll leave it open for those who want to still engage. Christina has posted the Slido link. So once again, thank you everyone for coming, and thanks for Thanks to the speakers, thanks to Karen, and I wish you a very pleasant day or evening or afternoon, and I hope to see you next time. Bye-bye.
Bye, everyone. Thanks.